Hey, my name's Audrey and this is my partner Alice. We did our project on the CDC's infection control recommendations for dentistry, and our three objectives are discuss the CDC's administrative recommendations for dentistry, describe the proper personnel protective equipment for the CDC's recommendations, and understand the CDC's recommendations for environmental infection prevention and control. Our first topic is administrative recommendations. So develop and maintain infection prevention and occupational health programs. Assign at least one individual trained in infection prevention responsible for coordinating the program and having a facility that has a system for early detection and management of potentially infectious persons at initial points of patient encounter. The second topic is education and training, which is providing job or task-specific infection prevention, education, and training to all dental health care providers. Provide training during orientation and at regular intervals, and maintaining records according to state and federal requirements. Our third topic is dental health care personal safety, which is follow current CDC recommendations and policies for immunizations. Facility has well-defined policies concerning contact of personnel with patients when personnel have potentially transmissible diseases. And program evaluations are establishing routine evaluation of the infection prevention program, including evaluation of dental health care providers' adherence to infection prevention practices. Another topic that we have is hand hygiene, which is you're supposed to perform when hands are visibly soiled after barehanded touching of instruments, equipment, materials, and other objects likely to be contaminated by blood, saliva, or respiratory secretions. Use soap and water when hands are visibly soiled, otherwise an alcohol-based hand rub may be used. Personal protective equipment that you should be wearing during dentistry is your barriers like your gowns, your gloves, your mask, and your eyewear and your bonnets. Respiratory hygiene, cough etiquette, implement measures to contain respiratory secretions in patient and accompanying individuals who have signs and symptoms of respiratory infection, beginning at the point of entry to the facility and continuing throughout the visit.
So our next topic is going to be sharp safety. So consider sharp items that are contained with patient blood and saliva as potentially infective, and establish engineering controls and work practices to prevent injuries. Place used disposable syringes and needles, scalpel blades, and other sharp items in appropriate puncture-resistant containers located as close as possible to the area where the items are used. Safe injection practices include preparing injections using aseptic technique in a clean area. Needles are for single use only. Medication containers are entered with a new needle and syringe even when obtaining additional doses for the same patient. Do not use single dose medication vials for more than one patient. Do not combine leftover contents of single use vials for later use. And if multi-dose vial is used, dedicate to a single patient and dispose of after use. If used for more than one patient, restrict to a centralized medication area. Sterilization and disinfection of patient care devices includes cleaning and reprocessing reusable dental equipment appropriately before use on another patient. Wearing appropriate PPE when handling and reprocessing contaminated patient equipment. And assigning responsibilities for reprocessing of dental equipment to dental healthcare personnel with appropriate training. Environmental infection prevention and control includes following manufacturer's instructions for use of cleaners and EPA-registered disinfectants, selecting EPA-registered disinfectants with label claims for use in healthcare settings, and establishing policies and procedures for routine cleaning and disinfection of environmental surfaces in dental health care settings. Dental unit water quality, using water that meets EPA regulatory standards for drinking water, using sterile saline or sterile water as a coolant or irrigant when performing surgical procedures. And of course, since COVID-19, we've had a few things that have been put in place in dentistry. Here are some 5 key points. They include consider postponing elective procedures, surgeries, or non-urgent outpatient visits, implement teledentistry and triage protocols, implement policies and procedures related to COVID-19. DHCP should follow certain protocols to limit self-exposure and reduce spread, and implement physical distancing. Thank you so much.